Hello and welcome back to the Pain Free for Life podcast. I'm your host, Dr. Rob Van Bergen, and today I'm talking with Brooke Ingram. Brooke is a registered nurse and board-certified licensed acupuncturist, combining the best of ancient Chinese and conventional medicines. She earned a bachelor's and master's in nursing from Johns Hopkins University. She completed her acupuncture studies at the Maryland University of Integrative Health and holds a master's of acupuncture. It's Brooke's goal to work in partnership with you to achieve optimal wellness and embrace a healthy lifestyle. In this episode, Brooke and I discuss the power of acupuncture, the substance of meridians, and dispel some myths about both, as well as discuss all of the successes that she has found by combining microcurrent and acupuncture together.
Welcome back to Pain Free for Life, where we share how to successfully overcome all kinds of chronic and extreme conditions to live happy, productive, pain-free lives forever. And now, here's your host, co-founder, and board-certified holistic healthcare practitioner, Dr. Rob Van Bergen.
Hi, Brooke. Thanks for coming on the show.
Hi, Dr. Rob. How are you today?
I am great, thank you. And we're going to talk about a topic that I don't think we've actually talked about on the podcast before, which is a little bit of acupuncture, a little bit of electroacupuncture. So I'm excited because you kind of do this day to day, every day. What we do with acupuncture points here at Pain Free for Life, for those who are not familiar, we do recommend certain ones, but we're not acupuncturists. I think I've got my little friend here. For those of you who are watching this on video, there are so many acupuncture points in the body that we don't use. And our acupuncturists will use any combination of a lot of these points depending on what it is that they need to achieve. But we'll get into that as we go through. So I'm very excited to talk all about this. But Brooke, could you start by just telling us a little bit about yourself and what it is you do?
Absolutely. So I have worked as a registered nurse for, it seems like forever now, but it probably was a second career. So it's more like 12 or 13 years. And so I bring the nursing background, that traditional medicine background to my acupuncture practice. And I feel like the combination is really what sort of I can leverage both to get better outcomes for my clients. A lot of acupuncturists as well as holistic practitioners sort of want to work to the exclusion of our conventional medicine system. And I feel like if we bring the two together, we actually are leveraging the best of both medicines and getting better outcomes. Because really it's about getting good outcomes for the client.
Yeah, absolutely. And I would agree in the same way, like we do, as you know, because you use our microcurrent devices, we do microcurrent. And I kind of consider microcurrent to be a little bit in dipping its feet in both. You see microcurrent in certain hospitals and clinics. It is science-backed, but then you also see it in alternative health. And combining both, and even from an analysis of the different things that you check out in conventional medicine that you don't even look at in traditional. I think that blending both worlds can be really, really beneficial. I've had two of our treatment coordinators have been registered nurses, and having that background when dealing with clients, it really does help to understand and look at these health conditions. Nursing is a little bit different than doctoring, but it has a lot of the same pieces. And I think that nursing tends to be a lot more care-based and getting to know the client instead of scribbling a prescription and walking away. So I love it. I love that combination. So when did you know you wanted to kind of go into this career path and kind of dive into what you're doing now?
I was working in a same-day pain treatment center, and all we really had to offer people was IV fluids, because a lot of pain was exacerbated by being dehydrated, and then IV pain medication, morphine, Dilaudid. And I would get super frustrated. The number of doses that I was administering, the number of days in a row, people would come back in reporting the same symptoms, or even at the end of a clinic treatment, really reporting no change in their symptoms. So I was seeing my own acupuncturist at the time, and I believe I wandered into my appointment complaining about some bonanza number of doses of Dilaudid I'd administered. And his response was, well, have you ever considered going to acupuncture school? And I was like, it stopped me in my tracks. So I was like, I have not. And I feel like I really need to seriously consider that. I'd had an awesome experience, my own healing path with the acupuncture, having initiated the treatment because of low back pain, which is an entry point for a lot of my clients. And then long after the low back pain was resolved, I continued to go because I found like I was sleeping better. I was working as a nurse in the hospital and I wasn't getting sick. I wasn't missing shifts. I was sleeping better. So I was like, okay, this is an answer to a lot of my concerns and discomfort with the current role that I was providing. So I went to acupuncture school and worked in the nursing setting for a number of years. And last year was finally able to completely leave my floor nursing job to do my acupuncture practice full time.
Wow. Awesome. So acupuncture is something that I'm sure has a lot of myths and misconceptions about it. So I think we should dive into a little bit of that. I know when I was younger, seeing on TV where they do acupuncture and thinking, oh, the needles just being put all over the body and the people like, fully like covered in needles, and thinking about how uncomfortable that might be. I mean, let's start with what is a common myth about the work that you do?
So I love that you shared that example because the common myth people come in with is really that they're going to be blanketed with needles. We're still very tied to Dr. Google and checking out, doing our own little research before we go into a new environment. So people have gone online. Most of the pictures are just people covered with needles. And I'm a less is more acupuncturist. I'm looking for the highest leverage points that I can utilize to communicate a really powerful message to the body, to leverage the innate healing capabilities. So not only am I just selecting maybe 4 or 5 acupuncture points, I'm also integrating the microcurrent device, as you mentioned, the Evasio device, in because that is it's not needles. So nobody has so far had a resistance to using that. It feels good and it really delivers the electricity in a way that complements the acupuncture treatment.
Right.
So it doesn't have to be a lot of needles to make this a really effective, powerful healing methodology.
Right. And so when you put the needles in, you're kind of like helping to balance the energy in the meridians. So one of the things I've always kind of looked at is I think the most crazy complex thing about acupuncture to me is that you have, as I showed on that acupuncture dummy, all of those different points to figure out. So you have to be able to figure out from talking to a person or looking at a person, which point is the point. Because as you said, you're doing minimal amounts of points that's going to be the most effective for them. So could you explain a little bit about what that process looks like? If I came to you, how would you know which points I needed?
I love that question. And you can probably see I have my acupuncture charts behind me. On that model that you have, you notice that there are lines that connect series of acupuncture points. So we call those channels. And I'm finding that most of the people coming into my practice are just really low on their energy levels. So there are when particular channels are low, then certain symptoms show up. And I ask a lot of questions about sleep, about nervous system, sort of how are people feeling? Has their nervous system regulated? and digestive issues, because our American lifestyles are typically high stress, and most people have a lot of digestive issues. So they're not taking in nourishment properly, and or they're not utilizing that what we do take in a way that is actually helping build cells and support overall health. So I'm asking into questions to help me sort of put my detective hat on to identify what are the channels that are really deficient. And then similar to, I think, some of the process that people who exclusively use your device are looking at, like, if we're sort of a battery, because the muscles are batteries and we're holding this charge, we're like maybe a 70% battery, a charged battery going through life. And you get stress, poor sleep, chronic health problems, and your battery level is just going down that much more. So by identifying the channels that are low, I can then support with acupuncture points on those channels to help build the resources in the body.
Perfect. And so how does it go when you're incorporating the microcurrent in? So are you putting the pads on specific acupuncture points, or are you just using it to support the muscles? What's the process there?
It's a little bit of both. Often there are two primary ways that I use the microcurrent device. Everybody who comes in for low back pain gets treatment with the pads on the back. And I'm always palpating or like pressing to find, does this hurt? Does this hurt? Does this hurt more? And finding those places where there's the most pain from just the pressing. And those are the places that are getting two of the points, right. Two of the pads. So that's, from my sense of the process, that pain is a point of either deficiency or where things are just kind of stuck. And the microcurrent brings in new resources and helps either unstick or build up the energy levels. And then I usually pick 2 points that are actually acupuncture points that serve to bring energy into the system. The most electrically conductive tissue in the body is the coatings of the nervous system, the epineural coverings. So a lot of times I'll pick points over top of the spine because I'm getting that electricity into the spinal column. And then it's got a bazillion pathways to move that electricity out through the body where the body truly needs it. Even if I have missed the point of some of my detective work, if I've missed some of the key points, there's still this intelligence in the body to move these resources where it's really optimal in restoring wellness in the body.
Yeah, I love that. It's a really good point, because a lot of people that do use the equipment get really hung up on the idea that you have to be so precise with the positioning of where you put it. But one thing I think people forget a lot is that our entire nervous system is electric. And so no treatment we ever do is just going to work on that area. It's working on the whole body. I remember in high school, I have a double kneecap. So one of my kneecaps, the top one, slips off if I'm doing a lot of activity. And I remember this would happen in the middle of school. And I'd be laying on the floor, and the school would call my mom to come in because it was essentially dislocated. And she would bring the microcurrent device, and it didn't matter where on my body she put it. Just a few minutes of putting it on my shoulder or whatever, it would help to pull things back into place because it's realigning that energetic system. So it is really important. And it's the same thing. I always look at that too, from a microcurrent to acupuncture perspective. Again, look at this model here. Like, there's almost nowhere you can treat on your body where you're not going over different meridians and you're not working on these energy pathways. And it's interesting, as my wife has learned more and more about this too. that she'll say, oh, my lung meridian's hurting today. She'll know kind of right on those points. And, taking a deep breath and it hurts on that meridian point, you can start to figure out these connections and see that the body, it's always connected. I know one thing my dad loved doing with acupuncture, he said, was that some of the end points of these channels were often the furthest away you could be from the organ system itself. And so then if something's unstable in an area, you can treat the far point without going too close to it, and it's going to make it there. So I just think I think it's fascinating how these systems are all interconnected. Do you find that there are big misconceptions around acupuncture and how it's going to work and what it works on?
So I think it's become a lot more accepted as to support pain relief. A lot of adding the research that the federal government did to add that acupuncture benefit into Medicare really validated acupuncture as a reliable treatment methodology for low back pain. I wish it was a lot easier benefit for people to access, but that's the whole story for like days worth of podcasts, probably. And it has also a lot of other applications. So I'm seeing people, like I said, for digestive issues, for a lot of emotional issues, anxieties, depressions, and really finding a lot of success when people have not found success in the traditional medical system with the SSRIs and a lot of those other chemical modulators. The electrical medicine is acting more immediately. The body doesn't need to break it down and metabolize it in order to replicate some chemical in the body. It's either uptaking it immediately as a resource, or it's directly stimulating the release of our neurochemistry. We've got this really great point between the thumb and the first finger that with a particular frequency, I can stimulate the release of beta endorphin, which is how much better of a job can we do leveraging the body's innate ability to manage its own pain than to use its own chemicals. So I think some of the misconceptions are around what acupuncture can treat, how it works. And I think there's still a little bit of mystery around that also. And then the giant misconception that you mentioned earlier was that it's going to hurt because it's needles. And we have this idea of getting vaccinations or getting blood draws, and that experience of our interaction with a needle. And there are times when the insertion process, it can be a little bit uncomfortable, but I always tell my people, if you're uncomfortable on the treatment table, then you're in a stress response, and healing's not possible in a stress response. My whole goal is to help you find a place of relaxation. And then from that relaxed place with the needles as well as the electricity, we're optimizing your body's ability to restore to its natural state of wellness.
Yeah, that's great. What would you describe the feeling to people? Like, how do you describe what it feels like when you put the needle in? Is it like a pinch? Should it be sensationless when they're relaxed? Like, if they're wondering what to expect.
And it can be a whole variety of things. Some people do say it's a pinch. Some people say, oh, I didn't even know that you put the needles in because I didn't feel anything. A pinch, I think, is probably more what's typical. I do some treatment of points in the ear. And because there's not a lot of extra tissue in the ear, those points can sometimes sting, is a descriptor that some people have used. Even with the individualized experience, there should still never be ongoing discomfort at any of the needle sites.
Right. So once it's in, if it was to continue to hurt, you'd be like, tell me. because I'll look at it kind of thing. Yeah.
Absolutely. Yeah. That's the beauty of having so many different options. If I can adjust the needle to relieve the discomfort, then I'll take it out and I'll move to another point, or I'll add something else in. There's a lot of flexibility in the treatment protocols and the application. And it's so individualized. I can have two people come to me with low back pain, and I'm going to treat them completely different, as opposed to more often than not, you go to physical therapy or you go to another physician and you get the same prescription, whether it's a pill or the same series of exercises. So it's been really wonderful to be able to individualize treatments for people.
That's awesome. What sort of like success stories have you seen? Like, would you have some that you were like, wow, I can't believe it was that big of a change?
I have one that I still tell and that I'm still sort of flabbergasted about. I had a woman come in and she said, I have ear pain. And I have been going to every doctor. For the last year, I saw my primary care physician. I saw the ear, nose, and throat specialist. I saw a neurologist. I saw an allergist. And nobody has been able to do anything to touch this ear pain. She left after one treatment with no ear pain. And she did make a follow-up appointment, which she came to. And she said, my ear still doesn't hurt, but my sinuses are a little congested. Can you help with that? Like, sure, let's help relieve some of the sinus pressure. And at the end of that appointment, I said, some people find it valuable to come back with some frequency for maintenance appointments. You certainly don't need to feel like you have to do that. And just give me a call if the ear pain ever comes back. And it's been 2 years and I have not heard from her. So I wish that was the kind of magic I could achieve for all of the clients that come in. It often takes between 5 and 8 treatments for people to feel like they're getting some sustained benefit from the acupuncture. And depending on the length that people have been dealing with their health issues, then sort of that can dictate the length of the therapy. The body, I was fortunate. She'd only been dealing with this for a somewhat short period of time, so we were able to unravel it for her very quickly.
Yeah. I think that's a big piece. Like, time can be a thing. Like, even a year isn't huge in the grand scheme of chronic pain. When someone's like, oh, it's been 25 years, you're like, okay, let's put the gloves on and get started, because we got a bit of a journey to take here. And some people are energetically, their energy is just more flowing already. And I think it's easier to harness that energy when we're trying to resolve issues for them. Is like, we can jump right in and they're going to respond really well. And some people have been through so much that their energy, their hydration, their nutrition is really bad. And then it's hard to build that up too, right? So this is where it comes in to combine all these different therapy types and look at them as a whole person. So as we're wrapping up here, what's one piece of advice that you can share with people that are listening?
Make yourself your number one priority. And I say that because we have treatment practices that are sort of, people come in an episode. They'll come once a week, or because it is an expense that insurance doesn't cover, maybe they'll come every 2 weeks. Well, what they do in between the treatment sometimes negates the treatment experience. A lot of my acupuncture colleagues, work to sort of counter that by increasing the frequency that their clients come to, maybe 3 times a week. And, that's not always feasible for a lot of people. So I do a lot of educating around diet changes, health habits, getting into a routine of sleep and a little bit of exercise, so that people can change their lifestyle in between appointments And then that really leverages the healing, whether it's acupuncture or massage or some other modality that they've found is beneficial by making themselves their top priority. That is going to really help move things forward in a more profound way than sticking with your normal habits and using or putting sort of all of your eggs in the basket of treatments. That you need to be in charge and empowered.
Yeah, I think that's one thing that is so important, because people have, I don't know whether it's society or what it is. We've built up this idea that we are not responsible for our health, and we have medical professionals that are. And so we've got this idea that we go to the doctor for 15 minutes, they write us a prescription, and then all we have to do is take this pill once a day, and we don't have to worry about it anymore. And I think what a lot of us are doing in the holistic world are we're trying to say, okay, you are the healer, you are the one in charge, and a chemical answer isn't necessarily always going to be the answer. But what you put into your body every day, what you do every day, the activities you do, and what you consume will over time build up to make you healthier and better. And I love that you're doing that to people, because it's not this idea of come and see me every day, because it does become cost prohibitive. And that can be a challenge for a lot of people. And especially in chronic pain, they may not have their full-time work anymore. So it's just putting all of this stuff together. So I love that, the education piece, teach people how to get better themselves, and you can help them keep making bigger strides, but then they're making those tiny strides along the way, right? So perfect.
Exactly. Working myself out of clients.
There you go. I love it. All right. Well, thank you, Brooke, for joining us today. This was awesome. It's always good to get a perspective into something new on the podcast. And acupuncture, as much as we talk about it in a very minimalistic way, this is the first time I think we've had a very big conversation about it. So thank you.
Absolutely. Thank you for having me.
Perfect. So to our listeners, I've included all of Brooke's information in the show notes at painfreeforlife.com/podcast. Until next time, I'm Dr. Rob Van Bergen, and you're listening to Pain Free for Life.
Thanks for listening to Pain Free for Life. Be sure to follow us, share the show with family and friends, and leave us a review on iTunes. Every time you share the show, you are helping someone take their life back from pain. Visit painfreeforlife.com for more resources, including our free guides to microcurrent, the Hache protocol and inflammation, as well as our blog and online community full of people just like you, successfully overcoming all kinds of chronic and extreme conditions to live happy, productive, pain-free lives forever. And stay tuned for the next episode of Pain Free for Life.